Hi, I'm Thomas. I'm from Perth, Western Australia. I'm your MC for this session. Today we have our speaker, Dr. Elina Christian. Following her presentation, we'll move on to a live Q&A session where Ellie will respond to your questions. You can submit questions through the Swapcard live discussion feature. Then after 45 minutes, we'll bring the session to an end. And now I would like to introduce our speaker. Dr. Elina Christian is, like me, from Australia. Well done. She's a medical doctor and the Australia coordinator for high impact medicine. Currently, she is finishing a Master's of Public Health degree. She's interested in global health and biosecurity. Today, Ellie will talk to us about global health intervention and in particular, this thing called the intention impact gap. Over to you, Ellie.
Thomas. So I'll just put my slides up. I hope you can hear me all well. Oh, okay, Thomas, if there's any trouble throughout, just let me know. I'll have my chat open as well. So today I'm going to talk about the intention impact gap in global health interventions, or in other words, how to support more impactful global health. As Thomas said, I'm a medical doctor and we'll go into that a bit more later on. But the way that I was kind of thinking of doing this talk was to talk a bit about what is high med and why it's necessary. What ways can we as individuals or as people in healthcare or people completely separate to healthcare, what ways can we do good in this field of global health, and what my path has looked like so far in this space. Sorry, my dog is there. So HighMed is a non-profit organization dedicated to inspiring and empowering medical students and doctors to make impact-driven decisions in their careers and in their giving choices. It was founded in November 2021, and it has conducted various programs, including introductory fellowships, career fellowships, and has interacted with about 500 doctors and medical students from around the world. And we do have quite a large reach globally across the country. Sorry, I might just get my dog inside. Apologies. So why do we need high impact medicine? Medical career planning is, you would think, fairly predetermined. People go into medical school, then you do a residency, then you will go into a specialty training and you pop out as a consultant medical doctor. Now there's obviously a whole range of different healthcare workers, but high impact medicine does specifically focus on medicine at this point in time. Within medicine, though, there is quite a focus on hospital or GP, general practice, primary healthcare, and there's also a recognition within high med that there is a lot of other ways that you can effectively save lives and reduce suffering, which isn't within the traditional biomedical model of care. And that was kind of what drew me towards public health as well. So talking about that and kind of that, noting the predetermined path that is often perceived as the way forward in clinical medicine, we like to think about it in this way, that while you have got so far, then you have chosen a specific path up until this point, there's still a lot of flexibility in what your future may hold, and in how your medical career could be different. So you can still make impactful choices no matter where along this journey you are in your career. And for me personally, I found out about EA and high impact medicine when I was already working as a doctor in the hospital. And I think it felt like I maybe would have made earlier decisions had I known. But now that I was at this point, I've tried to work little bits of impact into my career decisions from now, and that seems to be quite a common thread amongst doctors who work with us in higher med. So, to the title of my talk today, the intention impact gap in global health or in any sort of interventions. It's sort of trying to describe this idea that you have maybe really good intentions. And I think, again, sorry, I'm going on about people in medicine a lot, but people tend to go into medicine for really good intended reasons. And then you have maybe a end goal of having a really great outcome, whether it is like big goals in terms of global health metrics, such as maybe you want to help reduce under 5 mortality, for instance. And so somewhere along the way, there is often a pitfalls which happen, which can be not necessarily about laziness or like delayed gratification or other priorities coming up, but often there's a lot of misplaced effort that happens with the people who want to do good and then the actual outcome of doing good. So that's what I mean by the intention impact gap. And for this reason, I think, and we think at HighMed, that there is a really strong argument for the need to be able to monitor and evaluate what you're doing and consider whether you are actually getting towards this outcome of whatever it is that your goal is, and that you're not getting caught in the weeds somewhere along the way doing something that is potentially not actually having a benefit or may even cause unintentional harm. And to do that, as in a lot of healthcare, we like to have evidence base for our actions. And I think there is a really natural union between medical people with a healthcare background and EA, because there is such a data-informed basis for a lot of the decisions that we make. So intention impact gap here can be used to try and bridge, like we use data and RCTs to try and cover the gap between what we want and how we actually get there, and making sure that we're continuing along that path along the way. So many of you have probably seen this before, and I'm sorry if it's a pretty simple introductory kind of thing, but I would like to talk about this neglectedness tractability scale framework, because I think it comes up in healthcare a lot in terms of how can we compare different problems that are faced. How can we prioritize the broad range of problems that exist in the world, within healthcare, and within maybe individuals' own personal healthcare needs. Like when you go to see your doctor, maybe you have a few different problems, and which one are you going to decide to focus on? Or I think it's a good way to start to compare the different cause areas, and within that, you also need to somehow have your own personal fit and your own interests. And so there's a lot to sort of think about within even just this simple framework. And I think this idea of scale, neglectedness, and tractability can be used, for instance, in comparing healthcare interventions. So when we talk about screening, screening programs are something that are really large in scale in most countries. And screening is things like the cervical screening or pap tests, or we've just recently introduced CT scanning in Australia for anybody with a large history of smoking to try and detect lung cancer early. So these are things which are need this same idea that we're going to be checking what we're doing at every point along the way, because it might be more effective for the government and the limited resources that you pay as a taxpayer or you pay to your healthcare insurance company. It's important that that money is used to maximize the most well-being or the most good that can be done with that limited funds. And so this is something that is already done in the background in healthcare a lot through like governments and healthcare insurance agencies and so on. And the idea that we need to be very effective in what services we're providing, whether that screening program using the CTs, for instance, or doing pap smears on women every 2 to 5 years. Is that the most effective use, or would we be better off spending that money on treatment? So at the end of when we actually have the condition, or maybe in prevention and awareness campaigns. So those are all kind of areas where this comes up in healthcare and where there is data being used to bridge this intention action gap of healthcare problems. So this is from Toby Ord's book, and it's talking about how cost effective different interventions are. So as you can imagine, treating something with surgical treatment once the problem exists is not very good value for money. But of course, you have a bit of a moral imperative. You have somebody there in front of you who have the ability to treat. So of course you're going to treat them. But the idea in a lot of global health interventions, public health, and that we kind of like to look at a bit in high med, is that they're thinking about problems more broadly and where in the development of the problem could you intervene sooner, or could you start to do something earlier on that has a really high impact, so that the reliance on hospital-based care is not so heavy. If you were to put these few interventions, which are just directly regarding HIV/AIDS treatments or possible interventions, if looking at the scale, you probably would have the biggest influence on these two. I don't know if you can see my pointer, but on the education and condom distribution, because you can give education and give condoms to a very large proportion of the population, whereas if you're doing antiretroviral therapy or treatment for Kaposi sarcoma, that's only like the small number of people who have active diagnosed HIV/AIDS. So the scale is definitely in favor of condoms and education. In terms of neglectedness, this probably would vary between local contexts, but probably education as well would be would be the most neglected, although this would, like I said, vary depending on what the attitudes of what sort of socio-cultural attitudes are towards condom use, or whether sex education and transmission of AIDS is very well known in the region or not. And in terms of what is most tractable, so what is the most easily fixed, antiretroviral therapy does have really good outcomes, but you have to take the medication for a long period of time. And so there is some issues with that in terms of the long-term effects. And if you were able to prevent something in the first place, that's going to have a much greater influence on the years of life saved than even the most effective biomedical intervention that we know about. So for tractability and scale and probably neglectedness, you can see that these education interventions tend to outperform the medical interventions for most issues actually in healthcare. This is just one example. So I don't know if anybody's familiar with the John Steinbeck book of Mice and Men. We had to study it in school here. But I think there's a couple of things that I would like to pull out from this. The classic saying from this book it's actually from a poem, is the best laid plans of mice and men often go awry, which is to say basically that even if you have really, really good plans, really good intentions, you can have other circumstances come in your way, and that you need to kind of adapt for it. So Lenny and George are the two main characters in this, and Lenny is supposed to be the mouse. He's a bit slow, a bit blundering, and doesn't really know what he's doing. And George is the man with the memory and the foresight. And even with that, he doesn't really succeed any more than Lenny. And so, while this is a bit of a oblique reference, I think it's just to point out that you, even with all of these great plans, you still need to be living in the moment and considering what you're doing at each point. It's not something that you can just say, oh, I will do this, and then work towards it and just be living in the future. So again, that's a bit of a oblique reference, but my point here is that interventions can have unforeseen side effects. And I think if you're just living in the future of what you're planning to do and not going back and evaluating it and looking at what's actually happening on the ground, then your plans and your intentions can end up not where you had originally planned. In talking about the ethical considerations in doing global health, I think this is quite a fraught area for a few reasons. We've got quite a long history of global health interventions of typically paternalistic Western nations tends to go in and provide a particular intervention or a particular health care to another group of people. And within medicine, there's these four main considerations. So there's beneficence, which is the idea of doing good; non-maleficence, the idea of not doing harm; autonomy, which is pretty self-explanatory, allowing people to have self-determination; and justice, the idea of fairness. So these, I think, are quite important considerations, not just for medicine, but for any sort of intervention that you might be trying to implement, especially if it's not in a country or a culture that's familiar to you. So making sure this kind of comes back to the idea that you're not going to have negative effects, but also that you are consciously considering whether the intervention or the policy or the great idea that you have isn't actually infringing upon the autonomy of the people that you're doing it to. You want to be able to do any global health intervention with the people that you're wanting to help, not doing it to the people that you're trying to help. And just one final point on justice. I think looking at the cost effectiveness of different interventions, I think there is quite a strong argument that it's not really fair to be doing things just based off the geographical location of the person or the individual that you're trying to help. So it kind of comes into this idea that there is a broad moral circle that people sit within. And Peter Singer's done a lot of work with this, and you may be familiar with the idea of the drowning child. It's a thought experiment where he gets you to think about whether you would rescue a drowning child in front of you. And then what about if you were wearing expensive clothes? So then it had some cost associated with helping this child. And then what about if the child was drowning, but it was out of your line of sight? And then what if it was in the next state over from you, or what if it was further away? And this idea of do things matter less because they're further away or because they're harder to do is important, I think, in the ethical principle of justice and whether or not to intervene. And if you're intervening on a health intervention, then how will you decide which one to focus your limited resources on? And I think it's also quite natural to sit at different points along this continuum. And you don't have to be all in one way or the other, but it's just, I think, important to be considerate of where you actually want to be on this continuum, and then try and direct your career or your resources towards that accordingly. So having that kind of idea in mind, you've got your own personal idea of where you want to be on this continuum. And for me personally, I'm fairly familiar with the idea of preserving things for future generations, and I think that's really important. I really like the idea of impacting global health interventions that influence all people alive in the world today. That's probably my personal priority. So luckily there is these charity evaluators who have done a lot of the legwork in looking at all of the available research in what is being implemented in different charities and what is actually working. So this can help us make those data-informed decisions without having to go and understand every single charity that there is. Now, there's obviously a couple of caveats to this. Some people would say that you can't measure everything, which I would agree with, and we'll come back to that in a bit. But I think making data-informed decisions based off these evaluated charities is still more valuable than making non-data driven decisions, because at least we have some evidence, even if the evidence is not 100% perfect. I hope that makes sense. So within Giving What We Can, there's a Global Health and Wellbeing Fund within the Life You Can Save, which is an Australian organisation. They have a bunch of different cause area funds, including a health fund and a women's and girls fund. And then so within all of these, there is really great guidance and a lot of vetting of potential recipients of any donations or time that you might want to dedicate towards these cause areas. Within HighMed, we have a focus on health and how we can use doctors and their resources for the most good, to have the most impact. And the cause areas that we've kind of always focused on, which we are open to exploring new areas, is the global health space, public policy, influencing governments and multilateral organizations on their policy, and therefore having a lot outsized impact on what happens on the ground across the world. Health security, which is one of my personal interests, medical technology, mental health, and effective giving, which was what we were just talking about, how to make any donations that you do give the best and most impactful that they can be. So just briefly, I think we've got a few minutes left, do we, Thomas?
Yes, we do have some time left. And yeah, but feel free to keep going.
Okay, I've just got, I think, 2 more slides. So like I mentioned at one point, I found out about high impact medicine in my first year of working as a doctor in 2021. And since then, I've kind of tried to diversify what my own path has looked like. So I've continued working in clinical medicine, predominantly in emergency departments. And the reason I've chosen to do that is because I think it's quite useful to have a medical qualification, but then even more useful to be a specialist if that's within your scope. And I've kind of had a bit of a shotgun approach to trying different things and seeing what lands. And I've kind of just like continued along the clinical medicine pathway. And I think in the future, I would quite like to do some clinical work overseas. So I think having a good solid basis in my clinical life will be useful. And the other thing that I've tried to do, kind of based off HighMed's recommended areas, I was quite interested in public policy. So I pursued a Master of Public Health, which I just finished. And this has led me to do a bit of research into different interventions and to get to understand a bit more of the health economics underlying pretty much everything that we do in health, which was very, very interesting, but also has kind of circled me back to clinical medicine, because most research that you do, becoming a clinician researcher is quite well regarded, at least in Australia. And similarly for public policy, if you are a clinical specialist and then go into public policy, I think it's a bit of a longer term project, but I think it will be more impactful in the long term. And then on the side, I've done some other research and studies as well. So this was a slide from Marie who's our executive director at HighMed, which I really like, and I think can be useful to kind of map out what you're doing with your time. And so in terms of your career, that's been still a focus of mine, but I've been also doing some study along the side, and I've been doing some research in biosecurity. In terms of impactful side projects, that would be my work within the EA community with HighMed. And then through studying quite a lot and not working so much, I haven't been donating as much as I would like. But in the future, when I will have be working more consistently, then I will be donating more, and that will probably be to my preferred cause area, which is global health. So these are a few different ways that I like to think about it. So even if you are progressing along one part of your career path or along one aspect of doing good, it doesn't mean that you have to stop doing everything else. And having this kind of framework to be like, what am I actually doing and what am I prioritizing at this point, is useful to keep you on the path towards your main goals, and to ensure that you're not straying too far from your overarching values. This is a slide from Giving What We Can, and I think this blog post is really a really great read. When getting into a habit of donating something and having it as a percentage is like quite proven to be psychologically more influential than giving it occasionally. So doing like a percentage amount, if you're in the position to do so, can have really outsized impact. And I think one of the things that I've seen in a lot of medical related impact evaluations is that if you donate a good proportion of your income, then you will actually have a greater influence through the money that you donate than your work clinically. So that's always something to consider, and I think to consider diversifying your potential impact into donations and through these rigorously evaluated charity organizations. And on that note as well, I really like this website, Giving Multiplier, because if you have a particular organization that you're quite attached to, like I really love MSF, Doctors Without Borders work. This allows me to still donate to them and also match that with other effective charities, and it can be amplified in that way. And this, I think I might just leave this slide up. It's got some of the recommended global health interventions from, a lot of them come from charity entrepreneurship, but they're all very evidence-based, and we could talk a bit more about some of them if anybody has any interest, but these are a few ones that I would recommend and that have been recommended by Giving What We Can and other evaluation organizations. And finally, in terms of career stuff, I think having a mentor to identify and test any limiting beliefs about your personal ambition and personal potential can be really useful. I think being flexible along your journey is really important. That's something that I have tried to be gentle with myself about, and nothing is a forever step. And also within different things are possible for different people. So think about what is your non-negotiables in your career, and then try and put that within the framework of of your impact in all of those different ways, in your career, in your research, in your donations, and just figure out a way that works for you. And I think those are some important steps in order to not have such a big gap between what you intend to do in your life and the impact you want to have in the world and your actual legacy. So that's all. If you have any questions, this is the HiMed email, and thanks very much.
Thank you, Ellie. Okay, so please put in your questions. So if you go into the questions tab, okay, so let more people type the question. I can see there's one. Do you have any specific advice for current or prospective medical students on how to best prepare to contribute to effective global health or biosecurity interventions?
So for prospective medical students, is it, or for medical students?
Current or prospective medical students.
Yeah, I think so going back to this slide, these are kind of our broad areas that we would recommend, but obviously healthcare and health is an enormous space, and is likely to continue to grow in the next decades. So there is a lot of personal fit and finding something that you get kind of your foot in the door with. I think if there's anything that particularly stands out to you, then I'd encourage you to look into short-term internships and research within those spaces. HiMed runs a introductory fellowship, which spends about a week on each of these areas, and I think that's a really good introduction to ways to think about or potentially get involved in each of these cause areas. So I would encourage you to have a look at that and see which area piques your interest, and reach out to some people in the field, possibly do some research or internships, or just speak to people and just give it a go. Small bites, like maybe don't embark on a full master's degree, but get involved in something in a smaller way to see if you like it and test it, would be my advice.
Thank you. Next question. Is there a specific influence that led you to pursue a Master of Public Health, or did you have that in mind when you started medical school?
I definitely didn't have it in mind when I started medical school. I was very kind of anti-research almost. I thought that research was quite a boring part of medicine, and I didn't want to do it. I just wanted to work in emergency and do some of the fun things. I was drawn to Masters of Public Health because at that time that I came across HiMed and I came across EA and all of this, when I had my first year or two in the hospital, I realized how ineffective a lot of the things we were doing were, and people would cycle in and out of hospital, and you would put a lot of resources in this very end stages of different diseases without, I don't think there was any real investment or focus or consideration, at least within the scope of what I was seeing. There was no consideration of trying to fix things earlier on in the disease process. And I think for that reason, I just felt like personally very, very useless within like the public health system, and I wanted to do something a bit earlier on, whether it was in policy or I think I was quite interested in policy and trying to fix, trying to do some public health interventions that more on the preventative side of things. And that was what drew me to doing a Master's of Public Health. And then when I was doing public health, I found quite an interest in the health economic side of things and how we allocate resources. And I found that links really nicely in with the ideas of effective altruism and how to evaluate different interventions and how do you prioritize different causes. So that's kind of how I've ended up in public health, and now I have a much better understanding of research, and I am a lot more open to participating in it within my career, because I can see the benefits that having impactful research, having impactful research is extremely important for all of these reasons.
Thank you, Ellie. A question from myself as a non-medical person: how can professionals outside the medical field contribute to what you're doing?
I mean, I think there is a lot of things other than medicine and other than medics. A lot of people involved in healthcare that I think there's often quite a focus on doctors, and I don't think that is necessarily accurate. So I think effective giving with some of these organizations which do global health work, you will find with some organizations such as Doctors Without Borders, the proportion of doctors that they employ is not enormous. They also employ a lot of people within public health, so epidemiologists. They employ a lot of water and sanitation technicians. They employ like nurses and people to do the logistics. So there's a much kind of broader range of roles and within actually providing global health interventions than just being a clinical doctor. So I think if this is something you're interested in, definitely don't be limited by having or not having a healthcare background, because there is a lot of non-clinical work that goes into all of these areas, and having any sort of background in research, it can be really useful, because a lot of clinicians don't have very much background in research, and so there needs to be like a bit of both, like some good management or business skills. Pretty much anything can be used if you want to get hands-on and on the ground working for one of these really good organizations. I know some of these are really quite early on in their development as charities, and they often have positions opening up which are generally not for medical doctors only. They tend to be for a range of different roles within the organization. So something like Family Empowerment Media, they do radio broadcasts in Nigeria, and yeah, it's a great global health intervention without really any need for having a medical background. So research, working for these organizations, and donations would be my 3 top tips for somebody non-medical who's interested in this area.
Yeah, thanks, Ellie. That is inspiring. Now, you've shared the HiMed contact. What would be the best way for someone seeking help from HiMed? What's the best way to engage? What kind of preparations or background reading should we do before reaching out to HiMed?
I think if you're interested, there's no background reading that you need to have. If you go onto the HiMed website, which I haven't actually linked yet, but I think it's highimpactmedicine.org, they we have a get involved form, and then we contact everybody who fills out that form. That might involve you signing up to one of the courses. We do occasional meetups with people from around the world, like on Zoom like this, and try and connect people. So say you have an interest in biosecurity, we have a range of mentors within the biosecurity space that we can link you up with, and then you can start to get some of that specific experience related to whatever cause area you're interested in. And so it's just yeah, if you're interested in any of the areas that we've spoken about today, then we would love to hear from you through that form, preferably.
Thank you, Ellie. I I cannot see any more questions, so I think everyone is happy. Thank you so much with the presentation and answering our questions, Ellie. And this concludes our session. Thank you for watching.
Thanks, everyone, and thanks, Thomas, for facilitating.